So let's get into the different types of Hashimoto's. The classic is the one that's commonly described. Now, what is important about the classic is 0.5% to almost 30% can be associated with an underlying thyroid cancer, which is why it becomes very important to monitor Hashimoto's. What happens to thyroid in Hashimoto's? It gets attacked by the immune system and causes a lot of scarring and destruction. So there's an active destruction of the thyroid gland. The thyroid becomes firm to touch, has a lot of inflammation, and sometimes the scar, like here in this diagram I've tried to depict, these are the scars, and these areas, white areas, are the parts of the thyroid that kind of pop in through the scars. It's like you're pulling down ropes and almost the flesh comes out. So it's like little nodules. You'll find a lot of scarring and destruction due to inflammation, and the size of the thyroid gland becomes smaller. Whereas when you look at a normal thyroid gland, it's very robust. The cells are well formed. It's well orchestrated. There are no scars seen. So you can see a difference between what Hashimoto's technically should look like and what a real thyroid looks like. The second type of Hashimoto's that we see is seen in the older population. It's called the Fibrous. It has a lot more scars, and it's seen with almost like a tumor-like consistency of the thyroid, which means it has multiple nodules, but it's almost hard to feel. And a lot of times, these are the kind of patients who get biopsies done, because you can't get a clear picture. When you do a biopsy, it may come back as equivocal, which means they don't know if it's benign or malignant. And this is what leads to, unfortunately, removal of the thyroid gland. And then you're kind of put on a lifetime of drug replacement. What we really think the fibrous form of Hashimoto's is a far more advanced form of the classic Hashimoto's. Now, IG4 is a different type of Hashimoto's. There are some cells called lymphocytes and regular Hashimoto's. In IG4, you have plasma cells. It's a different type of cells that attack the thyroid. And there's less scarring. It's less hard than usual. There's some local inflammation on the veins of the legs. So it's called a phlebitis can be seen along with this form of thyroiditis. It's most commonly seen in men than women. So 3:1. So this is one of the Hashimoto's seen particularly in men. The other three variants are juvenile postpartum hashitoxicosis. These three are usually reversible or intermittent and sometimes self-limited. Juvenile is seen under the age of 18, and it can present itself with a goiter, and the kids tend to have normal thyroid function, high or low. Some of them go on to having low thyroid function for the rest of their life. Hashitoxicosis, it looks like Graves because there's a hyperphase, that's high thyroid. It lasts up to 3 years, but after that it's all downhill and goes down in function. The last one, postpartum thyroiditis, our character in the vignette in the beginning of this article had this. It's seen in 8% of the women, occurs 2 months to 5 months after childbirth, can present itself with anxiety and then go into postpartum depression-like symptoms. Now, what happens is if each pregnancy you get this Hashimoto's, and it happens because we never fix the underlying cause for the first episode of Hashimoto's, with each pregnancy, the chances that you would have a permanent form of Hashimoto's or a progressive form of Hashimoto's is very high. So we'll get into how do you know if you have Hashimoto's in the next video.